with beauty that people are now going on their lunch break to get their face injected with a poison so deadly that Saddam Hussein stockpiles it, okay? It's called Botox, and it removes wrinkles. Here to explain the new craze is Manhattan plastic surgeon Dr. Thomas Loeb and the All My Children star who plays the sex-crazed nympho but wrinkle-free Marion Colby, Jennifer Bassey. Okay, Dr. Loeb, what exactly is this Botox and how does it work?
Well, Botox, most of us think of it like as a poison, but it's really a medicine that can temporarily paralyze muscles that cause wrinkles. So when you give it to a patient, you can knock out the muscles that cause the forehead wrinkles or the wrinkles between your eyes or the wrinkles, some of the wrinkles around your eyes.
I say.
Jennifer,
yeah.
You know how much I love you, right?
And
I watch the show every single day. Girl, what in the world would possess you to let somebody put some poison in your face?
Well, you know, there comes a time in your life where, never mind. My agent 30 years ago said, you have a frowning problem on camera. It looks really bad.
Like where, in your forehead?
Here,
yeah.
Frowning and lifting. You know, and it looks very bad on camera. I did a movie recently and they said, oh, I had an orangutan massaging me. I was in a nude scene and I was raising my head up in a movie and the guy said, do you wrinkling your forehead? And I thought, oh, my Botox is wearing off, you know. So when I heard about that you could get injections to stop frowning, because I act with my forehead. I mean, now I'm frowning.
You're frowning?
I'm frowning now.
She's trying to.
I'm trying to
frown. And she can't do
frown.
it. The muscles aren't firing.
So in other words, you could try and kill me and I'd go, I'd die beautiful, but I wouldn't frown, you know.
But you can't express things with
oh, yes,
your
you can.
Yeah,
You don't
you
need
can.
your forehead
Really?
to express yourself, no.
Why, you could just wear bangs. I mean, for God's sakes, you're on TV, wear bangs.
You could wear bangs, but as you get older, darling, you start getting deep furrows here.
Yeah, over here,
okay? If you get injections, any line you have in your face will not get worse after you get these because you can't get any lines if you can't wrinkle or frown. So in other words, no more lines or no wrinkles. On a man, frown lines do not look bad. On a woman, I think they look bad.
Well, they sold us this bill of goods, but we don't necessarily have to buy it.
I watch myself. I tape the show and watch it and I go, oh, you're frowning, you know. And I mean, it looks unpleasant.
Well,
okay.
We do need to get this in
Now,
specific.
Dr. Loeb, at what point does this become a dangerous thing?
I don't think it's a dangerous thing. You have to give more than 5,000 times the normal dose that we give to a patient to cause real paralysis. And that's been tested in a lot of animals.
Okay. Have you had any problems with this at all?
No, sometimes when you use the Botox, it will paralyze the muscles temporarily, usually for 3 or 4 months. And of course, if you paralyze these muscles, your forehead and your eyebrows may come a little bit lower. So if you've been using those muscles for the last 2 years to keep your eyebrows up a little bit because you like the way that looks better, when you use the Botox, it may come down a little bit lower.
So wait a minute, are you talking droopy eye? I mean, is that
We're
doctor
not talking
speak for
That's a
you're
good
going to be like this, like Snoopy, or are you talking about?
We're not talking about droopy eye. We're talking about if you relax. A good way to test yourself is go in front of the mirror and relax your forehead. Look at your forehead. When you can make it so there are no lines there, look at yourself and see where your eyebrow position is, because that's what it's going to be like if we use the Botox.
Okay, look, can you show us how it's done?
Sure, we can show you how it's done.
We have someone in the audience here who
Sure. We have
is
a
gonna
patient
come
in the
up here.
audience who
Marlene.
Marlene, who's
How
had
do you do,
Botox
darling?
a long time
Marlene?
ago. I'm going to put on my gloves.
She's going to do it right here,
This is when
ladies
the
and
doctor
gentlemen.
usually says it's not going to hurt at all. It does
Marlene
hurt a little
Baum.
bit,
Right.
Yes.
but not badly.
Marlene, we really do appreciate you being here, especially since we did a whole segment on human guinea pigs and stuff, and doctors fully disclosing.
Yeah, you didn't ask me about that part, right?
So I have to assume that
She's
you
had
know
Botox
everything.
before. She's had it before.
I'm not a guinea pig.
And what we're going to do is,
I hate needles.
give little shots
Doctor,
to the
do you
muscle.
see the results immediately, or does it take,
No, you
how long
see
does it
that
take?
the results are usually seen about 3 days later, and the results usually last 4 or 5 months. But when the muscles come back, they come back slowly. So maybe 3 months later, you'll start to get a little bit of motion there. 4 months, a little more, and 5 months, you'll get full motion back.
She doesn't need anything on her forehead. Her forehead is completely smooth.
Well, she's had Botox before.
So then what are you doing to her now?
Well, we're giving it now because she's about to go.
With those rubber gloves on
She's
her
about
now.
to go on a trip, and she wants to get her Botox before she goes. It's starting to wear off, so she's starting to be able to move her forehead again and raise it up.
I see.
And, I can tailor it to different areas. We've got good pictures of Jennifer showing you before her Botox and after. I think those are good ones to show up.
While you are doing Marlene, there's the before and after of Jennifer.
Yeah, look at the before and after.
Huge difference.
Now, are there any side effects, like, do you get food poisoning from this? You're sticking, oh, this is gross. Whenever we see these on TV, we all get grossed out and everybody runs to get it.
But She's not flinching, so it's obvious that she's not having a huge aversion to the needle.
So doctor, there are
Hold that
no
right
side effects?
What are the side effects?
Yeah.
I always say,
No.
I always say the side effect of getting Botox is you might want other plastic surgery done because you might like the way your forehead looks so much that you may decide that you need to do something with your neck or your face.
Yeah, but if you do, you can't do this in another part of your face or you'd be stiff.
We actually
you
do.
wouldn't be able to talk.
You can't get rid of all those muscles, but you can do it around your eyes. You can do it for a few neck bands.
Oh, yeah?
And it's very popular in these two lines in the middle and the forehead. That's certainly 90% of the patients.
Jennifer, any ill effects to the drugs? Because we do want people out there to know.
No, but I had it 2 months ago. You can see now. I'm raising it now. I'm coming up. You can start seeing the lines coming back right here. I don't know if you can see it now or not. I'm doing it
So
now.
how often do you have to do it?
Well, my muscles like weight lift, you know, they're very strong. So
Yeah.
I got to do it more than normal people do it. Like
Which is?
every 3-4 months.
And how much does it cost every time?
Usually about $400 for this area and probably another $400 for the whole forehead. So maybe $600 to $800 for this whole area.
Every 3 or 4 months.
It's definitely a maintenance deal, so it's not for everybody.
Thank you so much for coming by. This was very interesting. Thanks to Jennifer Bassi and Dr. Loeb. We'll be right back.
And
Thank you,
Marlene.
really.
Thank you.
I just wear